Dry eye disease itself is quite common, and the percentage of dry eye that is due to meibomian gland dysfunction ranges anywhere from 5 to 20%. It causes quite a bit of impact to our patients' lives. The current standard of care for meibomian gland disease involves the use of artificial tears and warm compresses, but these provide only partial relief. There's another approach that has been inspired by patients who have dermatological rosacea, and since we know that IPL, intense pulse light, is very effective in treating rosacea, it seems plausible that it might be effective in meibomian gland disease and related dry eye. And that was the purpose of our study. This study involved the use of the M22 Optima device from Luminous, which is an intense pulse light system. The design of the study was a prospective single-armed study where 40 patients were treated at 2 sites in the United States. They had to have at least 2 of the following signs and symptoms compatible with moderate to severe dry eye: tear breakup time, a questionnaire, the SPEED questionnaire, to determine their symptomatology, their meibomian gland score, corneal fluorescein staining, and also tear film osmolarity. So it was a combination of objective and subjective measures. The patients also had to have at least 5 non-atrophied meibomian glands in each lower lid to be included in the study, and we limited participation to Fitzpatrick skin types 1 through 4. Our treatment protocol involved treating with IPL along the malar region, basically from ear to ear, including the bridge of the nose, followed by meibomian gland expression. The IPL settings were set according to the patient's skin type, and the total treatment time is very brief. It takes 5 to maybe 10 minutes. This particular IPL unit involves a cooled, chilled tip, which allows greater comfort for the patient, and it modulates the energy so that it maximizes patient comfort. Well, interestingly, IPL improved signs and symptoms of dry eye disease due to meibomian gland dysfunction at the final follow-up. Tear breakup time doubled, and symptoms on the SPEED questionnaire decreased by 1/2. The overwhelming majority of eyes experienced a significant reduction in signs and symptoms after the IPL treatment, and it ranged from a median number of signs and symptoms of 3 at the beginning of the study down to 1 at the end of the study. Our results also agree with several other clinical trials that have demonstrated good efficacy for IPL in meibomian gland dysfunction. The mechanism of action is not clearly understood for IPL. It might be that we are causing involution of abnormal telangiectatic vessels with downregulation of pro-inflammatory mediators, or perhaps upregulation of anti-inflammatory mediators. It could be that we're stimulating fibroblasts to improve collagen synthesis. It might be something as simple as eradicating Demodex. Whatever the mechanism of action truly is, it's clear that IPL has a role in treating this difficult group of patients.